Equine herpes virus 1 and 4, equine rhinoneutinitis, and epizootic abortion. The viruses occur worldwide. They're frequent diseases and they're the main viral disease in Equidae. The etiology of the disease, so the alpha herpes virus has the varicella-virus genus. This genus has equine herpes virus 1, which causes respiratory problems, abortion, and central nervous system problems. It affects epithelial, lymphoid, endothelial, and nerve cells. And the equine herpes virus 4 affects respiratory epithelial cells. The two viruses are antigenetically and genetically very similar. They're about 74% homologous DNA. For the epidemiology, the susceptible host is Equidae. The infection comes from latently infected horses, and the virus is latent in trigeminal neurons. The virus is shed in respiratory secretions, and it is found in a large amount in the fetus, placenta, and fetal membranes and semen. The virus remains as a latent infection until it is reactivated due to stress. It can cause an abortion storm due to studs, and the maternal antibodies last 3 to 6 months. So the pathogenesis of the disease, it can enter the body through porous or an aerogenic infection. The primary replication happens in the nasal mucosa. This leads to viremia in the lymphoid cells. Then secondary replication happens in the central nervous system, such as the brain, spinal cord, and endothelial cells. These cells experience inflammation and degeneration. The secondary replication also happens in the lungs and the fetus. In the fetus, it causes number 1, necrosis of the microcotyledons, and number 2, it causes fetopathy. The clinical signs are rhinoneutinitis, and it has mild respiratory signs, such as serous nasal discharge, cough, dyspnea, and fever. In adults, it has a subclinical infection. It can also cause abortion in pregnant mares after the 5th month. Abortion can occur 3 weeks to 3 months, so basically several weeks after the infection. It seems sudden and unexpected without clinical signs. However, the virus has no effect on fertility and breeding cycles, especially during the regular estrus and fertility. In stallions, it decreases sperm quality and decreases libido. The virus also causes central nervous system signs. The hind limb is mainly affected. It causes paresis, paralysis, and ataxia. In the pathology, we can expect to see interstitial pneumonia and necrotic foci in the liver and lungs of the fetus. It also causes lymphohistocytic encephalitis, and intranuclear inclusion bodies can be seen. For the diagnosis, we need to do virus isolation from the nasal discharge, which comes from the lungs, and from the fetus placenta, doing CPE. The virus can be detected directly by seeing the PCR and the immunohistochemistry, and indirectly by looking at the antibodies and viral neutralization. 3 circles are the gold standard. The treatment, it's non-specific, just do supportive and symptomatic care. For prevention, follow the general epidemiology rules. Isolate pregnant mares and have good cleaning and disinfectant. The immunization, so the vaccination, only protects against respiratory, not against abortion and central nervous system signs. The vaccine is mainly an inactivated virus, so a polyvalent for equine herpes virus 1 and equine herpes virus 2 and equine influenza. The foals are given the vaccine at 3 months old, twice, and it's repeated after 4 months. The pregnant mare is given the vaccine at the 5th, 7th, and 9th month of pregnancy, and it's repeated every 6 months.